Hi, this is Nilus Mattive for Money and Markets TV. For months now, I've been warning that Social Security is in big trouble. And the now program's trustees are confirming my fears, saying that the outlook, quote, has worsened significantly. Last year's report predicted the program's trust funds would run out in 2036, causing a 25% reduction in payments from that point forward. But now the trustees say those funds will be exhausted in 2033, 3 years sooner. This latest report is not a big surprise. Every year it seems the forecasts are just more and more dire. That's partly because the underlying math is problematic. People are living longer, there's a smallish percentage of Americans in the workforce, and wage growth is likely to be slower going forward. But unfortunately, our leaders are making things worse, not better. Just consider the revenues going into Social Security. In 2011, inflows were $148 billion less than outflows plus administrative costs. For 2012, the trustees see an even bigger annual shortfall of $165 billion. So what would it take to fix the problem? The trustees say we could increase the existing regular Social Security tax rate by another 2.6 percentage points. Or we could immediately reduce benefit payments by 16.2%. Or we could find some combination of those two adjustments. Of course, there are other alternatives. For example, Washington could simply raise or completely eliminate the current cap on wages that are subject to Social Security taxes. And if I were a betting man, I'd wager that will be the first thing they try to do. After all, the majority of voters would love it, especially given all the 99% versus 1% rhetoric making the rounds. I'm not saying I agree with that solution, but I do think it's probably the one that will happen. Of course, if adjusting the cap on wages is the obvious course of action to improve the Social Security situation, it still begs the question, what are we supposed to do about Medicare? After all, Medicare taxes already apply to all of a worker's income, and Medicare is in even worse condition than Social Security. According to the same trustees' report, Medicare will start having payment problems by 2024, when it will only be able to hand out 87% of the benefits currently being promised. So what would it take to write this program? Well, the current 2.9% tax levied on all wages would have to go up to 4.25%. But that assumes a scheduled cut in Medicare payments is actually going to happen. And it's also based on the belief that the new healthcare reform law will remain in place. And speaking of which, if that law didn't exist, Medicare would only be able to pay full promised benefits through 2016. Obviously, there are a lot of ifs involved in these calculations, and it's not good news for any of us. But because it's an election year, I expect politicians will try to steer us as far away from these issues as possible through November. Of course, at some point, they're going to have to acknowledge what's already clear to the rest of us, that the current math related to our country's entitlement programs is simply not adding up. I'm Nilus Mattive for Money and Markets TV. Thanks for watching.